Diuretics are medications that help your body get rid of excess fluid, primarily water and sodium. These medications are often referred to as water pills because they promote the excretion of water from the body. By doing so, they help to reduce the overall fluid volume in the body, which can be beneficial in a variety of medical conditions. They are commonly prescribed for conditions like high blood pressure, heart failure, and kidney disease. In these conditions, excess fluid can accumulate in the body, leading to symptoms such as swelling, shortness of breath, and fatigue. Diuretics help to alleviate these symptoms by removing the excess fluid. By increasing urine output, diuretics reduce the volume of fluid in your bloodstream, lowering pressure on your blood vessels and heart. This reduction in fluid volume can help to lower blood pressure, making it easier for the heart to pump blood throughout the body. Additionally, by reducing the workload on the heart, diuretics can help to prevent complications associated with heart failure. This essay delves into the fascinating world of diuretics, exploring their mechanisms of action and their impact on fluid and electrolyte balance. Diuretics work by affecting the kidneys, which play a crucial role in maintaining the body's fluid and electrolyte balance. By altering the way the kidneys handle sodium and water, diuretics can help to correct imbalances and improve overall health. Diuretics work by targeting the kidneys, the body's natural filtration system. The kidneys filter blood, removing waste products and excess substances, including water and sodium. Diuretics enhance this filtration process, leading to increased urine production and the removal of excess fluid from the body. Understanding how diuretics work requires a closer look at the functional unit of the kidney, the nephron. Each kidney contains millions of nephrons, which are responsible for filtering blood and producing urine. Diuretics act on different parts of the nephron to increase the excretion of sodium and water, helping to reduce fluid buildup and improve overall health. The nephron is a microscopic structure responsible for filtering blood and producing urine. It is the fundamental unit of the kidney, playing a vital role in maintaining the body's internal environment. Each nephron is a complex and highly specialized structure designed to perform the intricate task of blood filtration and urine formation. Each kidney contains millions of nephrons, diligently working to maintain fluid and electrolyte balance. These tiny units are packed within the kidney's cortex and medulla, ensuring that our body can efficiently remove waste products and excess substances. The sheer number of nephrons in each kidney highlights the importance of their function in our overall health. Blood enters the nephron through a network of tiny blood vessels called the glomerulus. This is where the filtration process begins. The glomerulus acts as a sieve, allowing water and small molecules to pass through while retaining larger molecules like proteins and blood cells. Here, blood pressure forces water and small molecules from the blood into a cup-shaped structure called Bowman's capsule. This initial filtrate contains waste products, electrolytes, and other small molecules that need to be processed further. The filtrate, as it's now called, travels through a series of tubules, each with specific functions. These tubules are lined with cells that selectively reabsorb valuable substances back into the bloodstream while allowing waste products to pass through. In the proximal convoluted tubule, essential nutrients like glucose and amino acids are reabsorbed back into the bloodstream. This segment of the nephron is highly efficient, ensuring that the body retains necessary nutrients while continuing to filter out waste. The loop of Henle, with its descending and ascending limbs, plays a crucial role in concentrating urine. By creating a gradient of increasing osmolarity, it allows the kidney to conserve water and produce urine that is more concentrated than the blood plasma. Finally, the distal convoluted tubule and collecting duct fine-tune electrolyte balance and water reabsorption. These segments respond to hormonal signals to adjust the final composition of urine, ensuring that the body maintains homeostasis. Ultimately, the processed filtrate becomes urine, which is excreted from the body. This entire process is essential for removing waste products, regulating blood pressure, and maintaining the body's overall fluid and electrolyte balance. Thiazide diuretics like hydrochlorothiazide and chlorthalidone are commonly prescribed for hypertension. They work by inhibiting the reabsorption of sodium and chloride in the distal convoluted tubule. This action prevents these electrolytes from being reabsorbed back into the bloodstream, increasing their excretion in urine. By increasing sodium excretion, thiazide diuretics also promote water excretion. This diuretic effect reduces blood volume, lowering blood pressure, and easing the workload on the heart. Thiazide diuretics are generally well tolerated and effective for long-term management of hypertension. Loop diuretics such as furosemide and torsemide are potent diuretics that act on the ascending limb of the loop of Henle. They inhibit a protein responsible for transporting sodium, potassium and chloride, disrupting the kidney's ability to concentrate urine. This inhibition leads to a significant increase in urine output, making loop diuretics highly effective for rapid fluid removal in conditions like acute heart failure and pulmonary edema. Their potency, however, requires careful monitoring for electrolyte imbalances, particularly potassium loss. Section 5. Potassium-sparing diuretics, conserving potassium. As their name suggests, potassium-sparing diuretics prevent potassium loss, a common side effect of other diuretic classes. These medications are particularly important for patients who are at risk of hypokalemia, a condition characterized by low potassium levels in the blood. Hypokalemia can lead to muscle weakness, cramping, and even cardiac arrhythmias, making potassium conservation crucial for overall health. There are two main types: aldosterone antagonists and epithelial sodium channel, or ENaC, inhibitors. Each type works through a different mechanism to achieve the same goal: conserving potassium while promoting the excretion of excess sodium and water. Aldosterone antagonists, like spironolactone and eplerenone, block the action of aldosterone, a hormone that promotes sodium retention and potassium excretion. By inhibiting aldosterone, these medications help to reduce blood pressure and prevent fluid retention, which can be beneficial for patients with conditions such as heart failure and hypertension. By blocking aldosterone, these medications increase sodium excretion and spare potassium. This dual action helps to maintain a healthy balance of electrolytes in the body, which is essential for normal muscle and nerve function. ENaC inhibitors, such as amiloride and triamterene, directly block ENaC channels in the collecting duct, preventing sodium reabsorption and potassium secretion. This action helps to keep potassium levels stable while effectively removing excess sodium and water from the body. Potassium-sparing diuretics are often used in combination with other diuretics to maintain potassium balance. This combination therapy allows for effective management of fluid retention and high blood pressure while minimizing the risk of hypokalemia. By understanding the different types and mechanisms of potassium-sparing diuretics, healthcare providers can tailor treatment plans to meet the specific needs of their patients, ensuring optimal outcomes and improved quality of life. Section 6. Carbonic anhydrase inhibitors, multifaceted diuretics. Carbonic anhydrase inhibitors, like acetazolamide, are a unique class of diuretics with multiple uses. They inhibit the enzyme carbonic anhydrase, which plays a role in bicarbonate reabsorption in the proximal convoluted tubule. Inhibiting carbonic anhydrase reduces bicarbonate reabsorption, increasing its excretion in urine along with sodium and water. Besides their diuretic effect, carbonic anhydrase inhibitors are also used to treat glaucoma by reducing the production of aqueous humor, the fluid that fills the eye. They are also effective for altitude sickness by altering the acid-base balance in the body. Section 7. Osmotic diuretics, shifting water with solutes. Osmotic diuretics, like mannitol, work by increasing the osmotic pressure in the nephron. They are freely filtered at the glomerulus, but not readily reabsorbed, creating an osmotic gradient that draws water from the surrounding tissues into the tubules. This increased water flow enhances urine output, reducing fluid volume and pressure in the brain and eyes. Osmotic diuretics are primarily used to treat conditions like cerebral edema and acute glaucoma. Section 8. Fluid and electrolyte harmony, the balancing act. Diuretics are powerful tools for managing fluid balance, but their use requires careful monitoring of electrolytes. Sodium, potassium, chloride, and bicarbonate are essential for various bodily functions, and their balance is crucial for maintaining health. Diuretics can disrupt this balance, leading to electrolyte imbalances that can manifest as muscle weakness, fatigue, irregular heartbeat, and even seizures. Regular blood tests help monitor electrolyte levels and guide dosage adjustments to ensure safe and effective diuretic therapy. Section 9. Conclusion. Diuretics and your health. Diuretics are invaluable medications for managing a wide range of conditions from hypertension to heart failure. Understanding how they work, their potential side effects, and the importance of electrolyte monitoring is crucial for their safe and effective use. Always consult with your healthcare provider before starting or adjusting any medication, including diuretics. They can assess your individual needs, monitor your response to treatment, and ensure your overall well-being.